Hi, my name is Judith, and today we'll be talking about the importance of blood pressure and how to assess blood pressure. A Russian physician named Dr. Nikolai Kulikov discovered the difference between systolic blood pressure and diastolic blood pressure using the sphygmomanometer. The units being measured are millimeters of mercury that measures the blood pressure that passes underneath the cuff through the artery. Next, we'll be talking about pre-assessment.
Hi, my name's Yvette. We'll be talking about pre-assessment. What you want to do is make sure that your client or your patient has been resting for at least 5 minutes. Make sure that they haven't had any caffeine or nicotine at least 30 minutes prior to taking their measurement. You want them to sit down with their back straight up against the chair. Make sure that their feet are on the floor and not crossed. You're going to have your patient go ahead and lift their arm and put it up resting at heart level. And when you take the blood pressure measurement, it's preferable that you take it over a bare arm, but you can take it over a long sleeve shirt as well. We're doing this assessment because we're trying to get the measurements. We're trying to listen for is your systolic and diastolic pressure. Your systolic pressure is pretty much just the pressure that your arteries create when your heart contracts. The diastolic is the pressure your artery does when your muscles relax.
You do want to make sure that the cuff size is in correspondence to your patient's body size. For example, this is an adult regular, and this is the bulb, this is the valve that you will be turning when you are pumping. As you turn to the right, that means that it's closed, but when you turn it to the left, that means that you're releasing the air. This is the gauge that will tell you the measurements, the diastolic and the systolic pressure, and it measures in millimeters per mercury. You want to make sure that the artery mark is aligned with the brachial artery, so this is going to be facing up, and then you just wrap it around.
Hello, we are going to talk about the stethoscope. These are its ear tips. These are the ear tubes. This is the tubing, and this entire piece right here is called the chest piece. This is the stem of the chest piece. This is the bell, and this is the diaphragm. The stem does have the ability to turn left and right. We'll discuss that further during the procedure. Thank you.
Once you have the cuff, you will place it right above the elbow, aligning the artery mark with the brachial artery. Wrap the cuff tight enough so it stays in place.
First, you're going to turn the stethoscope so that the ear tips are pointing towards your nose when held near your ears. You're going to situate those ear tips into your canal so it creates a seal. And you're going to place the bell in between your index and middle fingers with the diaphragm facing the same direction as your palm. Then you're going to place the diaphragm on the brachial artery with a gentle amount of pressure.
So make sure you turn the valve to the right before you begin inflating. Once you're ready, you can begin to inflate to 180 millimeters of mercury or 20 millimeters of mercury above the first carotid sound.
You're going to slowly release the valve, turn it to the left, about 3 to 5 millimeters of mercury per second. You're going to try to hear for your first thumping sound, so it's going to be your systolic value. And then you're going to continue to listen. You're going to hear blowing sounds, and then you're going to hear a slight thumping, and it's going to go back to a swishing sound. And then your last value will be your systolic value. And then once you hear that last sound, go ahead and release the valve and take out the air and remove the cup.
Is considered less than 120 over less than 180 systolic over diastolic, prehypertension 120 through 139 over 80 through 89, high blood pressure stage 1 will be 140 through 159 over 90 through 99, high blood pressure stage 2 will be 160 or higher over 100 or higher, and the hypertension crisis when emergency care will be needed will be considered 180 or higher over 110 or higher.
If you need to do a second reading, you should wait about 3 to 5 minutes before starting the process all over again.
And if you're unable to hear, you can use the bell side of the stethoscope by turning the stem clockwise.